What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, RSV, or a test for some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues and no long-term issues from any of these viruses. It is time now for the Friday edition of the Virus Update for Friday, December 6th, 2024. That's right, we're coming to you today on Friday, not Saturday as planned. There's a lot of news that has popped up since our midweek update on Wednesday, and I do feel it is time. We just can't wait till Saturday. There are too many things that have come up, and probably by early next week there'll be a whole bunch more things that come up. Again, because it is once again a very busy news period. If you're new to my channel, this is where I do daily virus updates on all the viruses that can make us sick. So if you're new, subscribe down below. If you like this video, give it a thumbs up, hit that notification bell, and share this video with anyone you know. Already, we do have several news stories, which starts off with a developing international story that has been going on throughout the week. I did not mention it in the Wednesday update. I will be talking about it today. We'll talk about other things, and we're going to take a look at some new CDC data, which does include a new variant update. There is a different variant that now leads the way in the United States. I think you know what that variant is if you've been watching my channel. There's some other CDC data and some state data. So let's get right into it, shall we? First off, in the Democratic Republic of Congo, in the Congo province, which is a remote area within Congo, there is a mysterious illness that is going around, and we started hearing about this earlier in the week. We're starting to maybe get a little bit more in the way of information on it, but there are still way more questions out there than answers. BNO News is at it on X like they always are, and they really do a good job of breaking down of what is going on with this. And they said yesterday Congo's health ministry held a press conference about an unidentified illness in a remote area of Congo province. Here's a detailed summary written by their team. We're not going to read the whole thing, but there's a couple things that I do want to point out, and it says the outbreak is taking place in a very remote area with poor road access, especially now during the rainy season. So apparently it's the rainy season there, which makes the investigation more difficult. And personally, I did read that it sounds like the WHO, World Health Organization, is sending a team there. I think BNO News said something about that recently as well. Friday night of last week was when the health ministry was first alerted about this unidentified illness. The next day they sent a team there, and get this, based on an initial report from the team, there are currently 382 suspected cases, including 71 deaths. Of those, 27 died at healthcare centers and 44 died at home. So that is not good. And some of the early symptoms that they are finding with this are fever, cough, runny nose, headache, and body aches. And it says in the more severe cases, patients are also suffering from difficulty breathing. So it really resembles flu symptoms, the health minister said. And get this, a lot of these people who are getting really sick with this, out of the 382 suspected cases, 198 of them are in children below the age of 5, and 113 are 25 or older. And there's not much more that they know about this at this point. I mean, we could go on and on here and read the rest of this, but I do want to point this out. The earliest suspected case dates back to October, and they're saying, could it be COVID? And probably not at this time, but again, it's so early. Could it be H5N1? That was a thought that went through my mind, and honestly, we don't know that either. We don't know if it's waterborne. We don't know if it's airborne. We really don't know a lot just yet, but there are a few other things that are going on. In Hong Kong, they say they are stepping up health screenings from people flying from Africa due to the unidentified illness in Congo. And there was also this. Ohio Hospital says a patient who recently flew from Tanzania has been hospitalized with flu-like symptoms. A hospital spokesperson wouldn't say why they announced this, but there were rumors online earlier today. Yeah, that's strange that they were just randomly announcing that. Could it be connected? Maybe, maybe not. Chances are, I'm thinking maybe not, but I'm not going to speculate, but I do also want to show you this before we move on because we really do have a lot to get through today. A breakdown of cases and deaths for the unidentified illness in Congo. Deaths in the community, 44 are not included. Check this out. 17 deaths in the age group of people from, or kids, infants, 0 to 4 years old. 17. That's concerning. 5 to 9 years old, 4. 10 to 14 years old, 1. 15 to 19 years old, 1. 20 to 24 years old, 0. And 25 plus years old, 4. But again, let's go back for a second. 0 to 4 years old. 198 cases. That is relatively concerning, if you ask me. All right, this has to talk about, this deals with Hong Kong. Once again, Hong Kong is doing extra screening because of this mysterious illness. All right, in Colorado, walking pneumonia is becoming a problem, particularly among young children. That's not a good thing. It's something we've been talking about quite a bit during these updates lately. Walking pneumonia continues to be a problem. Thanksgiving, it was a big travel time. Not a good time for a measles case to pop up at LAX in Los Angeles, California, but public health officials are alerting about a measles case that did occur and did travel through LAX. An oh so busy time, and not just that airport, all the different airports. And yeah, want to learn more about this? I did tweet this out, and I think I am going to do a thread today on my site for all of the news stories that I am using today. All right, moving on to this. Pain identified as a dominant symptom in long COVID. I've seen a lot of people talk about having pain in long COVID, and believe it or not, it's something I have dealt with from time to time, but it's not directly because of long COVID itself. I'm dealing with asthma, so with my asthma, I'm getting injections. Well, with those injections, I have had the side effect once in a while of pain in my arms. I mean, wouldn't have had that if I never had to get injections for asthma, which asthma was caused by COVID-long COVID. But for some people, long COVID itself, which they got because they had COVID, is leading to direct result of some pain. Yes, it really is happening. Want to learn about this study? Well, that study will be posted on my site. I'll make sure, if I didn't get it there already, I'll make sure I do get it there. All right, moving on to this now. Prime Minister Lawrence Wong, who is the Prime Minister of Singapore, has tested positive for COVID. He has had to put his schedule on hold, and with him putting his schedule on hold, he is going into isolation until he is cleared of the virus. We wish him a full and speedy recovery. All right, showing you something else on my site. I do have a section on my site where I keep track of all these performers that have been sick, and that list is really growing. There's 51 replies there now, and it's an incomplete list. I never got stuff from early in the season. Just when did I start that list? I believe I started it back in June. Yeah, June 28th. So there was the whole earlier portion of the year. Next year, we're starting one right at the beginning of the year, and I'm doing something else next year, and might as well talk about this now. It's in my notes. Next year, when I get to that, we're going to be doing a list of sports players, and I think it's going to be 2 lists. This year I did, something for football, something maybe for the NBA. No, next year we're just going to have one dedicated list for all the U.S. sports players that come down with illness, and one dedicated list for all of the international sports players. Why, might you ask? There have been just a slew of strange happenings in the sports world. The NBA, constantly, and I do have this in my notes right here. Sports illness. The NBA is getting hit hard with illness day after day. I've been following the NBA long before COVID. I've been following all sports long before COVID became a thing. Let me tell you something. I have never seen so many players out for illness in the NBA. Every day, it seems like team after team is having problems. It seems like there's more injuries than there have ever been, and it goes outside of the NBA. Football, baseball, hockey. We already know there has been confirmed cases of people with long COVID in the hockey world around the world. There are runners who are collapsing. There are just so many different things that are happening. Soccer players. I have a soccer team here in my city. It is a professional soccer team, the Philadelphia Unions. Our goalkeeper, and I think I showed the story on this channel here about maybe a month and a half ago now. Our goalkeeper just collapsed one day and he just died suddenly, unexpectedly. He wasn't even that old. I think he was not even over 25 years old. There is something going on in sports, and there needs to be an archive kept of what's going on. I'm going to do a much better job of doing that next year. While we're at it, let's talk about some states that have reported this week. Now, the first few are daily states, and this is some data coming from CJS 83172. These are daily reporting states. Florida, and I believe this was on Wednesday. He put this on the Wednesday update. Florida had 319 new cases and 17 new deaths. New Jersey had 314 new cases and 3 new deaths. New York, 524 new cases. We will have an updated number from New York today, which is slightly higher than that. Puerto Rico, 144 new cases. Weekly reporting states. Arizona, look at this, 2,519 new cases, 420 new state-reported hospitalizations, and 15 new deaths. Indiana, 1,058 new cases and 3 new deaths. North Dakota, 208 new cases and 3 new deaths. Nevada, 281 new cases. South Dakota, 311 new cases. Tennessee, 899 new cases and 6 new deaths. Washington, 209 new emergency department visits and 73 new state-reported hospitalizations and 12 new deaths. And he did put a note. Delaware and Oregon, which typically report on Wednesday, didn't, while the 48 new cases in Hawaii is below. See, the cases have to be so high for him to report. If it's really low, he doesn't talk about it, but he'll put a note about it. 48 new cases in Hawaii, and I thought this was interesting. It's the state I live in. This is really bad. He says, PA, Pennsylvania, has had over 3,000 hospitalizations for COVID in the last 3 weeks. That is just horrible what is happening here, and I'll show you Pennsylvania's wastewater data in just a little bit. All right, let's go back to my browser. Nope, wrong one. All right, let's go back to the browser now for our virus update. Let's take a look at the UK. Good news out of the UK, cases dropped, but they only dropped slightly. I think they're going to reverse and maybe rise a little bit pretty soon, but we'll see. Maybe they won't, and if they don't, that would be fantastic news. Cases for COVID in the UK, 1,112. That's down by 3.8%. Deaths, 122. It does say here last updated on November 22nd. That is down by 25.6%. In the healthcare, they have 1,962 patients admitted. That's down by 25.5%. And autumn booster uptake up to December 4th, 57.6%. I would think that's got to be a lot better than here in the United States. The positivity rate for COVID in the UK is 5% at this time. Let's take a look at what's going on with air qualities across the United States. If it doesn't come up, it's going to be pretty easy to figure out. Bad on the West Coast, and not so bad in the East and Northeast, although just a few spots. Yeah, it's fireplace season in the Rocky Mountains, California, Pacific Northwest. You get the idea here. All those chimneys spitting out smoke is going to lead to bad air qualities, and that is the case right now. Want to learn more about climate and the weather? I do have another place where you can do that. It is over on Climate Data Report. I am going to do a video there this afternoon. I don't think it's going to be a 20-minute video like yesterday, but probably about a 10 to 15-minute video updating on what's going on. And the United States is in for a weather roller coaster. I might even show the story about what's going on over in Europe. I do believe you just had a flooding rainfall event, so that is something to talk about. Taking a look at what's going on in Philadelphia, and we can see here yesterday's EMS call volume for Philadelphia. Yeah, starting to go back up once again. 824 EMS incidents, and I know it says follow. That's because I'm logged into my other X account, the Climate Data Report one. I don't follow them there. Anywho, moving on, let's see if we do have an update for December yet out of Philadelphia. I've been waiting for this. Nope, still not there. Live look-in. Oh my. I really don't like seeing this. Wow. Check this out. This is Montgomery County, Pennsylvania. And first off, 22 EMS calls right now. Yes, the ugly head of post-Thanksgiving is starting to show its face for these respiratory viruses. Look, take a look at this. Not 1, not 2, not 3, not 4, not 5, but 6 respiratory emergency calls right now. Yeah, these respiratory viruses, they're clearly increasing in Pennsylvania. You just saw over 3,000 hospitalizations. There it is once again. Over 3,000 hospitalizations in the past week. 3 weeks for COVID in Pennsylvania. And just based on this, that number may grow even higher. Let's see what's going on in Chester County, Pennsylvania. Oh my goodness. Wow, this is really bad. Sick person, heart problems, non-emergency, heart problems, falls. Sick person again, stroke, respiratory difficulty again, respiratory difficulty again, cardiac arrest, stroke, sick person, heart problems. Sometimes I say, it's not the volume of calls, it's the severity of the calls. Today, it's not just the volume of the calls, it's also the volume of severity calls. I mean, there's a lot of severe calls here. This is just not good. And if this is happening here, I can only think it's happening in other places. We're going to take a look at the Northeast region for wastewater in just a few moments. Let's take a look at what's going on with the hospital situation in Pennsylvania. I would think with all those outstanding calls right now that are currently active, we are going to start to see this map lighting up. We're going to start to see more yellow pop up. You know what? It's already happening in southeast Pennsylvania. Yellow is not a good thing. Take a look at this. Mainline Health, I believe this is the Bryn Mawr Hospital, yep, and emergency department overcrowding. Yeah, that's just not a good thing. High patient volume has happened there multiple times today. Can we take a look at what's going on at the Paoli Hospital? I'm pretty sure that should have said Paoli Hospital. Whatever. Chester County, once again, yeah, look at this. High patient volume, emergency department overcrowding, extended wait times being reported at that hospital right now. And there are other hospitals in eastern Pennsylvania. The Lehigh Valley has a few that are dealing with problems as well. And speaking of the Lehigh Valley, just north of there in Monroe County, Pennsylvania. Yeah, look at this. Red showing up. What does that mean in the Poconos? A large increase detected over the last 15 days for COVID. And there's many reasons for that up there. Number one, it is post-Thanksgiving. Number two, something just happened in Pennsylvania last weekend, and I talked about this. Opening day of hunting season. Now, when I was a kid, that was 1 million hunters. It's still 800-something thousand. There are a ton of hunting camps in the state of Pennsylvania. A lot of people get together each and every year on the opening weekend of hunting season. It used to be a bigger deal because it would start on Monday. Now it starts on Saturday, but they get together in these hunting camps. Some of them are small. Some of them have 20 to 30 people. There's one in my family. We used to have 30 plus people. I think they had 25 this year. Hey, I wasn't there, but yeah, it's a good way for these viruses to spread, and I'm telling you, it is so underreported. In the early days of the pandemic, I was on top of this. I'm saying, you don't understand what's about to happen in Pennsylvania. These people are about to get together that likely don't take this virus seriously, and they're likely to be a big super spreader the weeks following in 2020. 2021, even 2022, we saw a significant increase in COVID in rural Pennsylvania. That was what brought COVID to rural Pennsylvania. Also the holidays, but and here we go once again. You can see it's increasing up there in the Poconos. That's also becoming a more populated region. Central region of Pennsylvania is still at this time. Now, the charts may show something different, and that's a whole issue within itself. We are seeing a decrease, large decrease in Indiana, Pennsylvania. You come down to southeast Pennsylvania, Chester County is starting to see an increase, and I'm concerned about that. Westchester, Pennsylvania, I believe it is tonight, has a big doing there, and it is their tree lighting. I think QVC sponsors it. That's an event that could cause COVID. Philly just had theirs yesterday. There's actually another one in Philadelphia tonight. So some concerning things going on there. Moving on now to Canada. We do need to refresh this. And the viral activity level for COVID-19 is moderate. Flu A is low. Flu B is not detected. RSV, this is a new change that just happened. RSV is now listed as high. That is not a good thing. Walgreens this week. The national positivity trend at Walgreens is 13.3%. 0.9%. The prior week is 12.6%. That was up by 0.7%. Total test, 3,696 versus 4,323. I don't think we're going to see any impacts until next week from Walgreens in terms of post-Thanksgiving, and I suspect if Pennsylvania does report next week, it will show up as red. Alright, I have to show you wastewater. Now here's the national picture. We can see it is in medium, and it's already listed as high in portions of the Midwest. But let's just take a look at national first. We can see here it's not really rising all that much. It probably will start to next week. RSV is rising. COVID, it was the first one I showed you here. That is not really rising all that much. Influenza A is rising. Disregard this wonky movement. Influenza B, very low, but it is starting to rise. Norovirus is still high. Alright, I need to show you the Midwest and the Northeast because I'm starting to get concerned. The Midwest has been gradually going upward. Little wonky movement at the end. That's for COVID. RSV is going upward. Wonky movement. That will likely get corrected. Influenza A is trending upward. Influenza B not moving up yet. HMPV low but starting to go up. Norovirus is very high in the Midwest region. Now take a look at the Northeast. Hello. Now, there is a wonky movement here, but even without that, it has been rising in the Northeast, and it is really starting to pick up the pace. A lot of times, when it comes to the winter wave, the Northeast is the first region to start to rise. First, sometimes the Midwest as well, and things are really starting to pick up the pace in the Northeast, and you can see here on this map, let me move this out of the way for a second. You can see here, there's a lot of orange, meaning there's a lot of places that are starting to come up high. We'll click on one of those in just a moment. RSV is also listed as low, but it is really starting to rise. I think that's going to either switch to medium or high relatively soon, should that continue. Influenza A, Influenza B, and HMPV still low. Norovirus is really high, maybe a little over-exaggeration at the end, kind of like what we're seeing with COVID at the end, but you get the idea. Norovirus is rising really high, so yes, we're starting to see a breeding ground for viruses in the Northeast. Taking a look at Portland, Maine, COVID is listed high there. And I just want to briefly take a look at some of these other Middlebury is this? This is Worcester, Massachusetts, actually. And we can see here COVID, yeah, it's listed at a high level. It's not rising at the moment. It was. Then there was a wonky movement. So we'll have to see what the next update does there. RSV, wow. RSV for you is absolutely exploding. And this is multiple updates with a little wonky movement at the end, but multiple updates have gone almost vertical at this point. And norovirus, wow. Your norovirus situation is really bad, and if you're thinking, oh, well, maybe it's a small wastewater site. No, it's not. 250,000 population. That is relatively concerning. Just to be fair, let's take a look at the South and the West. COVID is not really rising that much in the South yet, and perhaps RSV has done an early peaking. It's starting to drop. We'll have to see what happens with that. And it is listed at high. Influenza A is low. Influenza B is low. HMPV is low. Norovirus is rising at this time. And not much in the way of problems with the other viruses. And let's take a look at the West real quickly because we got a lot more things to go through. I think we're going to probably actually do yet another video again, maybe on Sunday. Maybe we'll do the old-fashioned wastewater, but I got a feeling there's going to be, just between the rest of this afternoon and tomorrow, I got a feeling there's going to be a lot more news once again, because it is really busy period right now. In the West, you can see COVID is still low, not rising just yet. RSV, there's a wonky movement at the end. It is not actually going straight up like that. It may be going upward, but just not straight up. And Influenza A was rising, then it went down again. That's going to get corrected, but overall it is rising. Influenza B is low at this time. HMPV, again, wonky movement at the end. Norovirus overall has been going upward. Alrighty, we do have some new CDC data. Hopefully this will be included. I've been constantly hitting refresh on their wastewater page, and again, if it has not updated, we'll get to this maybe on Sunday, because I don't think I'm going to get to a Monday video next week. And let's see here. Did this update yet? You know what? I don't know. It looks to me like this is the same number from last week. But overall, you get the idea here. The number of red and orange sites on this map, those are sites with high and moderate to high COVID levels. You're starting to see a few more pop up, but it's not at the concerning level just yet. And the national COVID viral activity level in the United States is still listed at low. Alright, this I know updated. I did a tweet on it, and I posted on Blue Sky about it. Drum roll, please. The new variant update is in from the CDC, and no surprise, XEC did take over. Is it another JN.1 from last winter's holiday wave? No, it is not, but it is still different than KP 3.1.1. It's not terribly different. It's pretty much the same, but XEC just now leads the way. And as you can see, if it was a more significant variant, we would see places all across the country just rapidly rising. We're not seeing that. We are seeing the Northeast, which is starting to pick up the pace more so than other places. XEC being at 44%. KP.3.1.1 is at 39%. MC.16%. LF.7 is at 3%, and I think I read somewhere we have to keep an eye on LF.7. There's a couple of other future variants, subvariants down the line. Remember, these are all descendants of the old JN.1 variant, which was the holiday variant last winter at the holiday season. All right, moving on. You can see here, emergency department visits for people diagnosed with COVID is up at this time. And if we do a Sunday update, I'll go more into depth on this. And so it is starting to rise. Once again, it's in the early stages. And taking a look at COVID here for epidemic status. Big change on this map. A ton of states now, post-Thanksgiving, are growing. I'm not going to list every state, but you can see here, primarily in the Midwest and the Northeast, and then there's a lot of states that are likely growing. Now, I should note this. Mississippi, you are declining at this point, and in Nevada and Alaska, you're likely declining. So still some good news for you. We'll see how much longer that can hang on, but hey, if it continues for you, that is good news. Take the good news when you can get it. Taking a look at flu, well, the majority of the states now are in growing status for flu, and likely growing would be Mississippi, Nevada, and California at this time, and there are some states that are just not estimated, and of course Missouri has to make that list because I don't know what's going on with your data. You just, for whatever reason, a lot of times, more times than not, you just do not have data updating. And here's the influenza-like illness map. I keep hitting refresh. This looks to me like the same update from last week. Sometimes it updates late. This past week it didn't update till Monday, so we'll have to see. Maybe there's something on Sunday. If not, we'll get to this map again next week. Taking a look at New York State, 744, and you know what, let me refresh this. That is correct. 744 cases. Remember, on Thursdays, they do add in the data from New York City. So today's 744, yesterday was 845, and let's take a look at hospitalizations. Remember, these are COVID cases, and it does not include these things right here, the at-home test. Taking a look at what's going on in New York State for hospitalizations, 432. That is lower hospitalizations than this time last year. I don't even need to look at that. I just recall that being lower. In fact, just to be fair, let's change that to this time last year, shall we? I think we can try and do that. It's not letting us. Let's see. What was the precise number at this time last year? Yeah, they were already at 1,000. I mean, take a look here. It's clearly evident. Much lower than this time last year. However, I always like to add other things in. While that number may be lower, the number of people, not just New York State, all around the world who are dealing with long COVID right now is obviously higher than last year, and some of that does require people needing to use healthcare, so healthcare utilization overall, you know, it may be better for COVID, but you still have more people than ever showing up with long COVID, post-COVID issues at the hospitals, which, again, is one of the reasons why hospitals are constantly busy. I'm seeing people who work in emergency departments and work in these hospitals who report to us on X or Blue Sky stating what is going on in their hospitals, and a lot of them are saying, yes, these are people who have had a COVID infection. All right, coming near the end here. I know, really long video today. Taking a look at Ohio. Ohio had 3,081 new cases reported this week, and of course this has to refresh on us. At the same time, they have had an increase in hospitalizations and the number of people utilizing the ICU. Their deaths, I can tell you, did not go up this week. Eventually this is going to come back, and if not, that's okay. You get the point here. Ohio, the state of Ohio, is starting to rise once again for COVID. And that's going to be the theme in many places, but again, they are a portion of the Midwest. Here we go. Hospitalizations, 119, so they increased by 119, and no, that does not mean they have 119 active people in the hospital. That just goes to their grand total from 2020 of 155,530. ICU admissions, we have 7 there, and deaths, 18 new deaths were added. All right, finally today, taking a look at Los Angeles. We'll get to California on Sunday if we do actually do a Sunday update. Again, of course, follow me on X and over on Blue Sky, where I will let you know if there's going to be an update. Like today, I put a posting out today saying, hey, we need to do an update today. Hospitalizations in LA. Yeah, they're creeping up. It was 202. Now it's 232. Deaths actually went up slightly, but it's not that many at this time. Cases. Take a look at this. Cases are starting to rise a little bit, and the positivity rate there is 2.44%. Not a big increase. Wastewater is increasing slightly, and emergency department visits for people diagnosed with COVID look like they are flat over the previous week. Alrighty, folks, that does it for a very long Friday edition of the Virus Update. We will likely have another update again on Sunday. I'm sure there's probably going to be a lot of things to get through. I don't think it'll be a 30-minute video, though, on Sunday. If you enjoyed this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. I will see you all again on Sunday. Until I see you again on Sunday, stay safe, everyone. Have a fantastic weekend. Please, really, be careful out there. There's a lot of viruses going around right now. Take care. Enjoy your Friday evening. Thanks for watching.